Around 1992 or 1990, I had foot drop nerve pain in my left leg and in a lot of pain, and my leg started deteriorating quite a bit. So I was in the market of looking for orthopedic surgeon who could help me out. So I went to various hospitals in the area in New York, Pennsylvania, New Jersey, and Dr. Moore at Hunter Medical Center was one of the surgeons that I had researched. And I have a cousin who's a nurse practitioner up in New York State. So I had her review all the doctors and hospitals that I had visited, and she recommended Dr. Moore at Hunter Orthopaedic surgeon as a surgeon for me. She said his qualifications were top of the line, and because it was close to home, she felt that this was the perfect fit for me. So that's how I got introduced to Hunter Orthopaedic. I had a lot of nerve pain and foot drop in my left leg, and because my muscles had atrophied to a large extent, so when I had met with Dr. Moore and he examined me further, I was basically bone on bone, and my bones were starting to deteriorate because the muscle mass was gone in my leg. So at that point, he recommended a total knee, if he could even get the total knee in my leg. So when we went into surgery, and I had mentioned to Dr. Moore that he was to make the call, if he could not get the total knee in, that he would make the call on what to do instead of my family. And so he did put the total knee in about I'm not sure, I think it was 1994, 95, around that time. And he had told me that I had to take extra care of it because he felt that once that knee went, he didn't know if he could get another knee in my leg. So it's been since 1994 or 5 that I've had the total knee, and it's perfect to this day. Well, our standing joke is that Dr. Moore keeps me walking. And because I was on a cane for about 12 years and a walker, my shoulders took a lot of beating. So I've had shoulder surgery, both shoulders Dr. Moore has operated on. And also because of the way I walk, my gait was off. I had a lot of trouble with the fascia in my right hip. So Dr. Moore operated on that twice and cut a window in the fascia, which relieved a lot of pain. So because of one injury, it kind of snowballed. And ironically, when I came to Dr. Moore, he told me almost everything that was going to happen in progression. And he's been, unfortunately, right on. When I first started coming here, it was a very small practice, and I really liked that because I almost knew everyone and everyone knew me. From a small family, it's evolved over to a large family, and you don't get lost, which I really was afraid of in the beginning, but you don't get lost in like a needle in a haystack. You're still known, and people know of you and know your history, and it's such a great feeling.